That's you. You're standing in a room full of dying people. The air is so thick with the smell of rotting flesh and vinegar, you can barely breathe. Your leather mask with its long beak makes everything worse. Through the small glass eye holes, you watch a mother convulsing on a straw mattress. Black swellings the size of apples are bulging from her neck. Her children are huddled in the corner, waiting their turn. You know they'll all be dead by morning, and there's absolutely nothing you can do to stop it. But before you see how your story ends, you need to understand how a barber's apprentice became the masked figure now walking through hell on earth. You're 17 years old, working in your father's shop in Marseille, France. It's 1625. Your days are spent shaving beards, pulling teeth, occasionally setting broken bones. Honest work. Simple work. Then the ships arrive from Italy. Within 2 weeks, people start dying. Not one or two, hundreds. The actual physicians, the university-trained doctors, they flee the city immediately. They know what's coming. The city council is panicking. They need someone, anyone, who can treat the sick. That's when they make the offer. The pay is extraordinary, 20 florins per day, more than your father makes in a month. But there's a reason the money's so good. The last 3 plague doctors died within weeks of taking the job. The council doesn't even try to hide this. They're desperate. Your father forbids you from accepting. Your mother begs you to refuse. But 20 florins per day? You could buy your own shop, marry the merchant's daughter who won't even look at you now. Actually become something. You take the job. They give you the uniform 3 days later. The leather coat goes down to your ankles, thick enough to stop a blade. The gloves are stiff, treated with wax. And then there's the mask. That beak is stuffed with dried flowers, herbs, camphor, anything that might filter the poisoned air everyone believes carries the plague. The glass eye holes are tiny. Your field of vision shrinks to almost nothing. When you put it all on, you stop being human. You become something else. A crow. A demon. Death itself walking around in leather. Level 1. The Apprentice. Your first house call is to a family of 5 in the Port District. The father opens the door, sees your mask, and just starts crying. Not because he's sick, because he knows what your presence means. His family is marked now. Officially plague victims. No one will come near this house again. You walk inside. The smell hits you even through all the herbs in your beak. Sweet rot mixed with human waste. The mother's in bed, barely conscious. The buboes. That's what they call the swellings. They're clustered in her armpits and groin. Some have already burst, leaking this yellow-black pus all over the sheets. You're supposed to lance them. That's the treatment. Cut open the swellings to drain the infected blood. You've never done this before. Your hands are shaking as you pull out the lancet. The blade's small, sharp, designed for precision. You press it against the largest bubo on her neck. Ah! She screams. The sound is completely inhuman, like an animal. Pus just erupts from the wound, spraying all over your leather coat. The children are watching. They'll never forget this. Neither will you. You pack the wound with a poultice made of onion and garlic. It won't help. Everyone knows it won't help. But you have to do something. The mother dies that night. 2 of the children show symptoms by morning. You go back the next day and the day after that, just watching this family disappear one by one. The father's last. He doesn't even fight it. Just lies down next to his dead wife and waits. You record their names in your ledger. The city requires documentation, proof of death for the official count. 5 more marks in a book that's filling up faster than you can write. Your days become routine in the most horrifying way possible. You wake at dawn, put on the costume, walk the quarantine districts. The leather coat makes you sweat even in winter. The mask makes every single breath a conscious effort. You carry a cane, not for walking, to examine patients without touching them, also to keep desperate people away. They grab at you sometimes, begging for help, for medicine, for miracles. You don't have any of those things. All you have is a lancet and a ledger. You're 19 when you perform your first autopsy. The university doctors won't do it. They're too important, too educated to cut open plague corpses. But the city needs to understand this disease. They need someone to look inside the bodies and report what they find. You draw the short straw. The corpse is a dock worker, dead less than 6 hours, still warm. You make the first cut down the center of his chest. The ribs crack as you pry them open. His lungs are filled with fluid, black and thick like tar. His liver is swollen to twice its normal size. The buboes extend deep into his lymph nodes, creating these pockets of infection throughout his entire body. You write everything down in careful detail. Temperature of the body, color of the organs, how far the swelling spread. You're building a record, a scientific account of what this disease actually does. Not that it helps anyone. You still can't cure it, can't even slow it down. But at least you're documenting it, creating knowledge for whoever survives this nightmare. That night, you burn your clothes and scrub your skin raw with lye soap. Doesn't matter. The smell never completely goes away. You're 21 when you realize you've stopped feeling things normally. A child dies in your arms, and you just record the time of death. A man begs you to save his pregnant wife, and you explain with perfect calm that she'll probably be dead by evening. Your emotions haven't disappeared exactly. They've just moved somewhere else, locked behind a wall that gets thicker every single day. You need this wall. Without it, you'd lose your mind. The city is transforming around you. Entire neighborhoods get quarantined, with guards posted to shoot anyone who tries to leave. Bodies pile up faster than the corpse collectors can handle them. They're digging mass graves outside the city walls, just enormous pits filled with hundreds of bodies and covered with lime. The churches are packed day and night with people praying for deliverance. You stopped praying months ago. If God's watching this, he's definitely not intervening. You meet another plague doctor named Michel. He's older, maybe 35, been doing this work for 3 years. 3 years. Most people don't last 3 months. You ask him how he's survived so long. He just shrugs. Luck, he says. Pure dumb luck. He teaches you the real tricks of the trade. How to spot the difference between bubonic plague and pneumonic plague, the lung version that kills even faster. How to identify which patients might actually survive, the ones where the buboes form but don't spread, maybe 1 in 10. How to avoid getting infected yourself. Change your clothes completely after every house call. Never touch your face. Assume everything is contaminated. Michel dies 2 weeks later. Pneumonic plague. He was coughing blood one day, dead the next. You're the one who has to examine his body, document his death. Your hands don't shake anymore. You just write down the details and move on. There's always another house, another family, another corpse. Level 2, the practitioner. You're 23 now. You've survived longer than almost anyone in this profession. The city council actually knows you by name. They start sending you to the worst cases, the noble families dying behind locked doors who don't want anyone to know. You walk through these mansions filled with priceless art and dying aristocrats. The plague doesn't care about wealth. A countess dies just as ugly as a beggar. You get creative with treatments because you have to do something. You try bloodletting, following the old medical texts. Doesn't work. You try mercury compounds. Makes things worse. You try quarantining the sick in separate rooms. This actually helps a little, not with curing them, but with stopping the spread. You write detailed reports to the city council. They mostly ignore them, but you keep writing anyway. The money just piles up. 20 florins per day, every single day, for years now. You've saved more than your father earned in his entire life. But there's nothing to spend it on. Most shops are closed, entertainment's banned. Gatherings of more than 3 people are illegal. Your money just sits there, growing, while you walk through death wearing a leather coat and a bird mask. You're 25 when you meet Isabella. She's the daughter of a cloth merchant, one of the few families in your district that hasn't been touched by plague yet. You see her watching from a window as you pass by. The next day, she's there again. The third day, she waves. You wave back with your cane. It becomes this routine, this tiny moment of normalcy in an absolutely insane world. One day, she's actually waiting outside when you walk by. She wants to talk. You explain that it's dangerous, that you're probably contaminated. She doesn't care. You talk for maybe 5 minutes, standing 6 feet apart. She tells you her name, asks about your work. You lie and say it's not so bad. She sees right through it. You start meeting regularly, brief conversations through your mask. She never asks you to take it off. Somehow that makes it easier. After 3 months, you ask her father for permission to court her. He refuses immediately. You're a plague doctor. You're death on 2 legs. His daughter will marry a proper merchant, someone clean. Isabella doesn't accept this. She keeps meeting you anyway, in secret now. You fall in love somewhere between the mass graves and the quarantine zones. It's the only beautiful thing in your entire life. You're 26 when the order comes that changes everything. The sick houses. The city's establishing dedicated plague hospitals to isolate the infected away from the healthy. In theory, it's brilliant. In practice, it's a death sentence for everyone sent there. You're appointed chief physician of the largest sick house. 200 beds, no windows, no ventilation. Just rows and rows of dying people packed together in the dark. The conditions are absolutely unspeakable. Patients lie in their own waste because there aren't enough attendants to clean them. The smell is so overpowering that even your herb-filled mask can't filter it. Food is scarce. Medicine is non-existent. Your job isn't to heal anyone. It's to manage the dying. Keep them comfortable in their final hours and document their deaths for the official records. You implement what changes you can. You separate patients by symptom type. Bubonic cases on one side, pneumonic cases isolated completely. You mandate that attendants wash their hands between patients. Most ignore this. You enforce basic sanitation, having the floors cleaned with vinegar twice daily. The death rate drops slightly. Not much, maybe 5%. But 5% of 200 people is 10 lives. You'll take it. Isabella visits you outside the sick house. You tell her to stop coming, that it's way too dangerous. She refuses. She brings you food, clean clothes, news from the outside world. These brief meetings are the only thing keeping you sane. You propose to her on a Tuesday afternoon. You're still wearing your full plague doctor costume. She says yes immediately. You plan to marry once the plague passes, if it ever passes. You're 28 when the worst day of your life happens. Isabella's father shows symptoms, then her mother, then Isabella herself. You get summoned to their house by a neighbor. When you arrive, Isabella's in bed, burning with fever. The buboes are already forming. You know exactly what this means. You've seen it hundreds of times. She has maybe 3 days. You move her to a private room in the sick house. This is completely against regulations, but you don't care anymore. You treat her with everything you know. Lancing the buboes, cool compresses for the fever, quarantine to prevent pneumonic complications. You barely sleep, spending every free moment at her bedside. She's delirious most of the time, calling out for her parents who are already dead. On the 3rd day, she stabilizes. The fever breaks. The buboes stop spreading. You're witnessing something you've only seen a handful of times, an actual recovery. She's going to survive. You let yourself hope. That night, you sleep for the first time in 72 hours. You wake up to screaming. Isabella developed the pneumonic form overnight. The plague moved to her lungs. She's coughing blood, literally drowning in her own fluids. There's nothing you can do. Pneumonic plague is always a death sentence. She dies in your arms at dawn. You don't cry. You can't anymore. You just document the time of death, record her name in the ledger, and move on to the next patient. But something fundamental breaks inside you. That wall you built to protect yourself, it cracks wide open. You keep working, but you're just operating on pure mechanical routine now. Wake up, put on the costume, treat the patients, document the deaths, repeat. You're 30 when the plague finally starts to recede. Not because of anything you did, not because of medicine or prayer. It just burns itself out, running out of new victims. The death toll in Marseille alone is over 40,000 people, more than half the city's population. You personally documented 3,214 deaths. You can recite that number from memory. The city council wants to honor you, declare you a hero, give you a medal and a public ceremony. You refuse. You're not a hero. You're just someone who survived something that killed almost everyone else. They give you a bonus anyway. 500 florins, enough to live comfortably for years without working. You take the money and buy a small house on the outskirts of the city, far from the port, far from the sick houses, far from everything. You're 32 when they call you back. New outbreak, this time in Lyon. They need experienced plague doctors. The pay's even better now, 30 florins per day. You consider refusing. You've done your time, survived your hell. But what else are you going to do? You're a plague doctor. It's all you know anymore. You accept the assignment. Lyon is somehow worse than Marseille. The city waited way too long to implement quarantines. The infection has spread throughout the entire population. You're put in charge of 4 sick houses, each one packed way beyond capacity. You hire and train new plague doctors, teaching them everything Michel taught you. Most of them are dead within a month. You just keep training new ones. You're 35 when you realize you've become the thing you once feared. The veteran plague doctor that everyone whispers about. The one who's survived outbreak after outbreak. They call you the crow behind your back. Some people think you're blessed by God. Others think you're working with the devil. You don't care what they think. You just do the work. You meet a young doctor named Thomas. He reminds you of yourself at 17. Eager, terrified, trying to save everyone. You take him under your wing, teach him the reality of plague medicine. You can't save them all. You can barely save any of them. Your job is to document, to learn, to make the next outbreak slightly less terrible. Thomas listens carefully, takes detailed notes. You think maybe he'll be one of the ones who actually survives. Thomas dies 3 weeks later, bubonic plague. You examine his body personally, looking for anything unusual. There's nothing. Just another young doctor killed by the same disease he was trying to fight. You write his name in your ledger and move on. You're completely numb to it now, totally hollowed out. You've lost count of how many people you've watched die. Thousands, tens of thousands maybe. You're 38 when you make a discovery. You've been documenting plague cases for 20 years now, and you start noticing patterns. The disease spreads faster in crowded areas. It travels along trade routes. Areas with better sanitation have lower infection rates. You write this comprehensive report detailing everything you've learned. You propose sweeping public health reforms, regular street cleaning, quarantine protocols for incoming ships, isolation hospitals built outside city centres. The city council reads your report, thanks you for your service, then ignores every single recommendation. The reforms would cost too much money, disrupt trade, cause panic. Your 20 years of experience, your documentation of thousands of deaths, your carefully researched proposals, completely meaningless. They'll implement nothing until the next outbreak forces them to. You're 40 when the summons arrives. Paris, the largest outbreak in decades. They need every experienced plague doctor in France. The pay is 50 florins per day. You don't even care about the money anymore. You just go because it's what you do. You're the crow. You walk into plague cities and document the dying. Paris is absolutely apocalyptic. The streets are filled with corpses. The sick houses are overflowing. The city has lost all order. You're put in charge of coordinating all plague response across the entire city. 73 sick houses. Over 400 plague doctors, most completely inexperienced. You organize them, train them, deploy them where they're needed most. You're not treating patients anymore. You're managing this massive operation of death. The work is endless. 18-hour days, 7 days a week. You're coordinating corpse removal, managing quarantine zones, analysing infection patterns, training new doctors, reporting to the city council. You've stopped wearing the full plague doctor costume. There's no point anymore. You've been exposed so many times that you're either immune or incredibly lucky. Either way, the mask won't make a difference now. You're 42 when you finally get sick. Not plague, just exhaustion. Your body completely gives out. You collapse in the middle of a sick house and wake up 3 days later in a bed you don't recognize. A young plague doctor named Marie is treating you. She learned from one of your students. She's read all your reports. She tells you that you're a legend among plague doctors, the man who documented the invisible patterns of death. You tell her you're just tired. She asks you the question everyone eventually asks. How have you survived so long? You tell her the truth. You have no idea. Maybe you're immune. Maybe you've just been incredibly lucky. Maybe you actually died years ago and just haven't realized it yet. You've been walking through death for so long that you can't even remember what life feels like. Marie looks at you with something between pity and horror. She's young enough to still feel things. You actually envy her that. You're 43 when you write your final report. 26 years of plague documentation, over 12,000 deaths personally recorded, detailed observations about transmission, symptoms, survival rates, comprehensive recommendations for public health reform. You send copies to every major city in Europe. Most file it away and forget about it. A few actually read it, maybe implement 1 or 2 suggestions. It's not enough. It's never enough. But it's something. You're 45 when the plague finally comes for you. Not the disease itself, just the consequences. You're walking through a Paris street when your heart just gives out, just stops. You collapse right there in the middle of the road. A younger plague doctor rushes over, someone you trained years ago. He recognizes you, calls for help. You wave him off. You know what's happening. In your final moments, you don't think about the thousands you couldn't save. You think about Isabella, about the merchant's daughter who loved a plague doctor, about those brief moments of humanity you found in the middle of hell. You think about all the young doctors you trained, the knowledge you passed on. Maybe they'll do better. Maybe they'll actually save some lives. Probably not, but maybe. Your legacy isn't the people you saved, because you barely saved anyone. Your legacy is the documentation, the careful records of how plague spreads, how it kills, how it might possibly be controlled. These records will be studied for centuries, will inform public health policy for generations, will save countless lives in future outbreaks. But you'll never know any of this. You die believing you failed. The young doctor who finds you goes through your belongings. He finds your ledgers, 26 volumes of careful documentation, names, dates, symptoms, outcomes. the most comprehensive plague records in existence. He makes sure they're preserved, copied, distributed to medical schools across Europe. Your observations about sanitation and quarantine become the foundation of modern epidemiology. But your name is mostly forgotten. You're just the Crow, the plague doctor who documented death. This is what plague doctors really were. Not mystical healers or brave heroes, just desperate people walking through hell, trying to make sense of senseless death, recording the patterns of disease while wearing a leather coat and a bird mask, watching thousands die while being completely powerless to stop it, living long enough to realize that survival isn't always a blessing, and somehow, through all that horror, building the foundation of modern medicine one careful observation at a time.